StemCells104, Frequently Asked Questions Continued, Part 4. This presentation was prepared by Dr. Max McLeod, D.O., N.D., Ph.D. Doc Max is also known as the Nutrition Ninja Doc. He's devoted over 5 decades to studying health and health optimization while being in clinical practice since 1979. He has 3 postgraduate degrees in the health sciences and is a contrarian, always looking for better ways to help people overcome their health challenges and achieve their health goals. He has been doing regenerative injection therapies since 1993 and has added human tissue products including stem cells, growth factors, collagens and cell signaling molecules over the past several years. As part of our continued series on stem cell frequently asked questions, we have taken some of the top questions from the top results of online searches. The website, questions, and answers will be cited, and Doc Max will provide comments and corrections as appropriate. This is a continuation of FAQs from Washington University Physicians website. The comments are by Dr. Max. Question number 5. How are adult stem cells obtained? Adult stem cells are most commonly obtained from the outside part of the pelvis, called the iliac crest. A needle is inserted in the iliac bone and bone marrow is withdrawn or aspirated through the needle. Several samples may be obtained from one area in this manner. The stem cells may then be separated from other cells in the marrow and grown or expanded in the laboratory. This may take from 7 to 21 days. When stem cells are placed in a specific tissue environment, such as bone, they become activated. As they divide, they create new stem cells and second-generation, progenitor cells. It is the progenitor cells which may differentiate into newer cells with the same phenotype as the host tissue. Comment by Dr. McLeod. As of 2023, there is a strict limit to the amount of manipulation that can be performed on extracted stem cells. Expansion of cells is not permitted in the U.S. Stem cells obtained from bone marrow, for example, cannot be grown or expanded and reinjected in the U.S., although this is being done offshore. Of note, however, is that expanding stem cells may not be the best choice due to frequent mutations with each expanded generation. i.e., increased quantity does not equal increased benefit and may be a liability. Question number 6. Why do scientists want to use stem cells? Stem cell researchers are hopeful that, in the future, a wide range of diseases and traumatic injuries will be cured by some application of cell therapy using stem cells. Currently, donated organs and tissues are used to replace lost or damaged tissue in many disorders. The great regenerative potential of stem cells has created intense research involving experiments aimed at replacing tissues to treat Parkinson's and Alzheimer's diseases, osteoarthritis, rheumatoid arthritis, spinal cord injury, stroke, burns, heart disease, and diabetes. While some success has been achieved with laboratory animals, a very limited number of experiments have been conducted on humans. These few experiments, however, have shown the great potential for stem cells. Scientists believe that a deep understanding of the complex phenomenon of stem cell differentiation will lead to a potential cure for serious medical conditions that are caused by abnormal cell division and differentiation, such as cancer and several growth and development disorders. Comment by Dr. McLeod. All of this is true. Unfortunately, scientists can only do things that they have research funding to do. There are many progressive research projects going on around the world. However, funding is very limited since stem cells do not fit the current medical economic model that is dominated by big pharma and the medical device manufacturers. Stem cells are an extremely disruptive technology to those industries, and they provide the lion's share of the funding for all medical research. To say that the current medical economic model is analogous to shooting ourselves in the foot would be an understatement. Another reason why stem cell biologists are excited about this field is that human stem cells could also be used to test new drugs. For example, new medications could be tested for safety by applying them to specialized cells differentiated from a stem cell clone. Cancer treatment, for instance, could benefit tremendously if anti-tumor drugs could be tailored to target the tumor stem cell. Comment by Dr. McLeod. This is one area where big pharma may actually support some stem cell research since it could potentially increase their profits. Question number 7. What are some examples of musculoskeletal treatments using stem cells? At this point, most musculoskeletal treatments using stem cells are performed at research centers as part of controlled clinical trials. Stem cell procedures are being developed to treat bone fractures and non-unions, regenerate articular cartilage and arthritic joints, and heal ligaments or tendons. These are detailed below. Bone fractures and non-unions. In bone, progenitor cells may give rise to osteoblasts, which become mature bone cells, or osteocytes. Osteocytes are the living cells in mature bone tissue. Stem cells may stimulate bone growth and promote healing of injured bone. Traditionally, bone defects have been treated with solid bone graft material placed at the site of the fracture or non-union. Stem cells and progenitor cells are now placed along with the bone graft to stimulate and speed the healing. Articular cartilage. The lining of joints is called the articular cartilage. Damage to the articular cartilage can frequently lead to degeneration of the joint and painful arthritis. Current techniques to treat articular cartilage damage use grafting and transplantation of cartilage to fill the defects. It is hoped that stem cells will create growth of primary hyaline cartilage to restore the normal joint surface. Ligaments and tendons. Mesenchymal stem cells may also develop into cells that are specific for connective tissue. This would allow faster healing of ligament and tendon injuries, such as quadriceps or Achilles tendon ruptures. In this instance, stem cells would be included as part of a primary repair process. Comment by Dr. McLeod. The biggest use of stem cell therapies over the past several years has been to help repair damaged and degenerated joints. Although still not FDA approved for such uses, it is abundantly clear that stem cells can dramatically enhance the body's ability to heal itself and regenerate damaged joint tissues. As mentioned multiple times, this runs counter to the current medical economic model as it eliminates a variety of much less effective medications and procedures, thereby drastically reducing the profits of big pharma and the medical device manufacturers. This is not meant to be an indictment of modern medicine, it is simply a statement of fact. Questions number 8. Why are doctors and scientists so excited about human embryonic stem cells? Stem cells have potential in many different areas of health and medical research. To start with, studying stem cells will help us to understand how they transform into the dazzling array of specialized cells that make us what we are. Some of the most serious medical conditions, such as cancer and birth defects, are due to problems that occur somewhere in this process. A better understanding of normal cell development will allow us to understand and perhaps correct the errors that cause these medical conditions. Another potential application of stem cells is making cells and tissues for medical therapies. Today, donated organs and tissues are often used to replace those that are diseased or destroyed. Unfortunately, the number of people needing a transplant far exceeds the number of organs available for transplantation. Pluripotent stem cells offer the possibility of a renewable source of replacement cells and tissues to treat a myriad of diseases, conditions, and disabilities including Parkinson's disease, amyotrophic lateral sclerosis, spinal cord injury, burns, heart disease, diabetes, and arthritis. Comment by Dr. McLeod. The main comment here is that I completely agree except for this referring to embryonic stem cells versus adult MSCs, particularly from umbilical cords, which have been demonstrated to be much safer and more effective than embryonic stems. There is much to be excited about with regard to all of the above using afterbirth product-derived stem cells which now appear to possess virtually all of the important traits of embryonic stem cells with none of the ethical concerns. We invite you to learn more about our innovative approaches to helping you optimize your health. Check out our website at artc.health, subscribe to our newsletter to receive future updates, or call us to schedule a consultation. ARTC, Health, 941-806-5511, doc at artc.health.